Question 1. A patient presents with a deep laceration on the left forearm due to an accidental fall at home. What is the correct main term to look up in the ICD's 10 cm alphabetic index for the diagnosis code? I. Fall. B. Laceration. C. Injury. D. Forearm. Answer B. Laceration. This question tests your understanding of how to use the ICD 10 cm alphabetic index effectively. The main term for a diagnosis is usually the condition, not the cause or the body part, unless the condition is not explicitly stated. In this scenario, laceration describes the patient's condition, making it the most appropriate main term to locate the correct code for the injury. Think about what the physician is treating. They are treating the laceration, even though it was caused by a fall. A great tip is to always focus on the disease, injury, or condition as your primary entry point in the alphabetic index. Question 2. Which CPT modifier is used to indicate that a surgical procedure was performed on the left side of the body? I. RT. B. LT. C. -50. D. -25. Answer B. LT. This question assesses your knowledge of CPT modifiers for laterality. The modifier LT specifically designates procedures performed on the left side of the body, while RT is for the right side. Modifier -50 is used for bilateral procedures, and -25 indicates a significant, separately identifiable evaluation and management service by the same physician on the same day of a procedure. Remembering these specific modifiers helps accurately convey which side of the body was treated, which is crucial for proper reimbursement and medical record accuracy. Question 3. What does the abbreviation SOAP stand for in medical record documentation? I. Subjective, Objective, Assessment, Plan. B. Symptoms, Observations, Actions, Prognosis. C. Surgical, Operative, Anesthesia, Postoperative. D. Systemic, Organic, Acute, Preventative. Answer I. Subjective, Objective, Assessment, Plan. This question evaluates your familiarity with common medical documentation formats. SOAP notes are a widely used method for healthcare providers to document patient encounters in a structured way. The subjective section includes the patient's reported symptoms. Objective covers observable and measurable findings, assessment is the diagnosis, and plan outlines the treatment strategy. Understanding this format is fundamental for coders, as it helps in efficiently locating the necessary information for accurate code assignment. Always remember that SOAP notes provide a clear roadmap of a patient's visit. Question 4. A patient undergoes an initial office visit for a new problem. The physician performs a detailed history, a detailed examination, and has medical decision-making of moderate complexity. What is the appropriate E/M code level for this visit? I. 99,202. B. 99,203. C. 99,204. D. 99,205. Answer B. 99,203. This question tests your ability to select the correct evaluation and management E/M code based on the documentation of key components for new patients. For new patient E/M services 99202-99205, all three key components, history, examination, and medical decision-making, must meet or exceed the requirements for the chosen level. A detailed history, detailed examination, and moderate medical decision-making precisely align with the requirements for CPT code 99203. It's essential to understand that for new patients, all three elements must be met to assign the E/M code, unlike established patients where only 2 out of 3 are needed. Question 5. In the ICD-10 CM coding system, what do the X placeholders represent? I. They indicate an unspecified code. B. They reserve space for future expansion and allow for the coding of additional digits. C. They signify a bilateral condition. D. They denote a principal diagnosis. Answer B. They reserve space for future expansion and allow for the coding of additional digits. This question focuses on a specific convention within the ICD's 10 cm coding guidelines. The X character is used as a placeholder in certain codes to ensure that the code has the correct number of characters and that the seventh character, if applicable, is placed in the correct position. For instance, if a code requires a seventh character but only has 5 characters, an X would be used for the sixth character. It's not about unspecified codes or bilateral conditions, but rather a structural component for code completeness and future growth. Always remember that X acts as a necessary spacer to maintain code structure and length. Question 6. Which section of the CPT manual would you find codes for procedures performed on the cardiovascular system? I. Medicine. B. Surgery. C. Radiology. D. Pathology and laboratory. Answer B. Surgery. This question tests your fundamental knowledge of the organization of the CPT manual. The CPT manual is divided into several main sections based on the type of service or procedure. Procedures related to the cardiovascular system, such as heart surgeries or catheterizations, are primarily found within the surgery section, which is further organized by body system. While there might be some cardiovascular services in other sections like radiology, e.g., diagnostic imaging, or medicine, e.g., stress tests, the primary surgical interventions are always in the surgery section. Knowing the general layout of the CPT manual is a crucial first step for efficient code searching. Question 7. A physician documents otitis media. Which part of this term indicates inflammation? I. OT/O. B. Itis. C. Media. D. Otitis. Answer B. Itis. This question assesses your basic understanding of medical terminology, specifically suffixes. The suffix itis is a common medical term component that consistently denotes inflammation. OT/O refers to the ear, and media specifies the middle ear, but it is itis that conveys the inflammatory process. Breaking down medical terms into their prefixes, root words, and suffixes is a key skill in medical coding, as it helps you understand diagnoses and procedures more accurately. When you see itis, immediately think of inflammation, which is often a clue to the patient's condition. Question 8. What is the primary purpose of HCPCS Level 2 codes? I. To report physician services and procedures. B. To identify durable medical equipment, prosthetics, orthotics, and supplies, MIPOs. C. To classify diseases and injuries. D. To bill for hospital inpatient services. Answer B. To identify durable medical equipment, prosthetics, orthotics, and supplies, MIPOs. This question delves into the distinct purpose of HCPCS Level 2 codes, which is different from CPT and ICD's 10. While CPT codes cover physician services and procedures, HCPCS Level 2 codes are specifically designed to describe items and services not covered by CPT, such as ambulance services, drugs, and crucially, durable medical equipment, prosthetics, orthotics, and supplies, MIPOs. Understanding this distinction is vital for proper billing, as using the wrong code set can lead to claim denials. Remember that HCPCS Level 2 often fills the gaps where CPT codes don't exist for supplies and equipment. Question 9. Which of the following is considered a component of medical decision-making, MDM, in E/M coding? I. Time spent counseling the patient. B. Number of diagnoses or management options. C. Review of systems performed. D. Physical examination elements. Answer B. Number of diagnoses or management options. This question tests your understanding of the key components of medical decision-making, MDM, a critical factor in E/M leveling. MDM is evaluated based on 3 elements: the number and complexity of problems addressed, the amount and/or complexity of data to be reviewed and analyzed, and the risk of complications and/or morbidity or mortality. The number of diagnoses or management options directly falls under the first element, While counseling time can be used to select an E/M level when more than 50% of the encounter is dedicated to it, and review of systems and physical examination are components of history and exam, respectively. Always remember to assess MDM by looking at the problems, data, and risk involved in the patient's care. Question 10. A patient presents for a follow-up visit after surgery within the global period. The physician addresses a complication directly related to the surgery. Which modifier should typically be appended to the E/M code? I-24, B-58, C-78, D-79. Answer: C-78. This question assesses your knowledge of CPT modifiers related to surgical global periods and complications. Modifier -78 is specifically used to indicate an unplanned return to the operating room for a related procedure during the postoperative period. The key here is unplanned and related complication. Modifier -24 is for an unrelated E/M service by the same physician during a global period, -58 for a staged or related procedure during the global period, and -79 for an unrelated procedure during the global period. Therefore, for a complication requiring an unplanned return for a related procedure, -78 is the correct choice. Always consider whether the complication was planned or unplanned and its relation to the original surgery. Question 11. In medical terminology, what does the prefix peri- mean? I. Before. B. Around. C. Through. D. Within. Answer: B. Around. This question tests your knowledge of common medical prefixes. The prefix peri- consistently means around or surrounding, as seen in terms like pericardium, around the heart, or perioperative, around the time of surgery. Understanding common prefixes, suffixes, and root words is essential for deciphering complex medical terms, which is a foundational skill for accurate medical coding. When you encounter peri-, instantly think of something encircling or located in the vicinity of another structure. Question 12. A patient undergoes an ultrasound of the abdominal aorta. In which section of the CPT manual would you find the code for this procedure? I. Medicine. B. Surgery. C. Radiology. D. Pathology and laboratory. Answer: C. Radiology. This question evaluates your understanding of CPT manual organization, specifically for imaging services. Procedures involving imaging techniques such as X-rays, CT scans, MRIs, and ultrasounds are primarily found in the radiology section of the CPT manual. Even though the aorta is a surgical concern, the ultrasound itself is a diagnostic imaging service. Always remember to consider the type of service being performed. If it's an imaging study, the radiology section is your starting point. Question 13. Which of the following is a key characteristic of an add-on code in CPT? I. It can be reported independently. B. It is identified by a ++ in the CPT manual. C. It requires a modifier to be appended. D. It describes a service performed on the opposite side of the body. Answer: B. It is identified by a ++ in the CPT manual. This question focuses on the specific characteristics and identification of CPT add-on codes. Add-on codes describe additional, secondary, or supplemental procedures that are commonly performed in conjunction with a primary procedure. They are always reported in addition to a primary service and are never reported alone, meaning they cannot be reported independently. The CPT manual explicitly identifies these codes with a ++ next to them. This visual cue helps coders quickly recognize codes that must be linked to a main procedure, ensuring accurate billing for comprehensive services. Question 14. What does the acronym ABN stand for in medical billing? I. Advanced Beneficiary Notice. B. Approved Billing Number. C. Agency Billing Network. D. Authorization for Benefits Necessity. Answer: I. Advanced Beneficiary Notice. This question tests your knowledge of common acronyms and documents in medical billing. The Advanced Beneficiary Notice (ABN) is a notice given to beneficiaries by providers, including physicians, hospitals, and suppliers, before services are furnished when the provider believes that Medicare probably or certainly will not pay for some or all of the services. It informs the patient they may be responsible for payment. Understanding the ABN is critical for compliance and to avoid billing disputes, as it ensures transparency with patients regarding potential out-of-pocket costs. Question 15. A patient presents with pneumonia. In ICD, what would be the first step in locating the correct code? I. Look up lung in the alphabetic index. B. Look up infection in the alphabetic index. C. Look up pneumonia in the alphabetic index. D. Look up respiratory in the alphabetic index. Answer C. Look up pneumonia in the alphabetic index. This question reinforces the fundamental principle of using the ICD-10 alphabetic index. When a specific diagnosis like pneumonia is stated, that specific condition should be your primary main term for searching. Starting with a general body part or symptom is less efficient and may lead to incorrect coding. The alphabetic index guides you directly to the appropriate code category for the diagnosed condition, after which you would verify it in the tabular list. Always prioritize specific conditions or diseases as your main term for the most accurate and efficient code retrieval. Question 16. In which circumstance would a coder typically use an unlisted procedure CPT code? I. When a service is provided on an emergency basis. B. When a physician performs a procedure for which there is no specific CPT code. C. When a procedure is performed on a bilateral basis. D. When a service is performed by an assistant surgeon. Answer B. When a physician performs a procedure for which there is no specific CPT code. This question assesses your understanding of when to use unlisted procedure codes. An unlisted procedure code is used only when a physician performs a procedure or service for which no specific CPT code exists. These codes end in 99, e.g., 49999 for unlisted procedure, abdomen, peritoneum, and omentum. When using an unlisted code, comprehensive documentation and a special report explaining the nature, extent, and need for the procedure are required. It's crucial not to use an unlisted code if a more specific code is available, so always perform thorough research before opting for one. Question 17. The abbreviation DX in a medical record commonly stands for I. Diagnosis. B. Dosage. C. Discharge. D. Durable. Answer I. Diagnosis. This question tests your familiarity with common medical abbreviations used in documentation. DX is a widely recognized abbreviation for diagnosis, referring to the identification of the nature of an illness or other problem by examination of the symptoms. Coders frequently encounter abbreviations in medical records, and understanding them is crucial for accurately extracting the information needed to assign codes. Learning common abbreviations like DX helps you quickly interpret clinical notes and ensure precise code selection. Question 18. What is the typical effect of a CPT modifier that indicates reduced services? I. It increases the reimbursement for the service. B. It indicates that a service was performed for less than the usual fee. C. It signifies that the physician provided a portion of a service or a service less intense than usual. D. It denotes a repeat procedure by the same physician. Answer C. It signifies that the physician provided a portion of a service or a service less intense than usual. This question focuses on the function of modifier -52, which indicates reduced services. When a procedure or service is partially reduced or eliminated at the physician's discretion, modifier -52 is appended to the CPT code. This typically results in a reduced payment because the full service was not performed. It is important for accurate billing to reflect the true extent of the services provided, rather than billing for the full procedure when only a portion was rendered. Remember, modifier -52 tells the payer that less was done than what the full code usually implies. Question 19. According to ICD-10 guidelines, what is the role of an external cause code? I. To identify the primary diagnosis. B. To describe the underlying disease process. C. To report the cause of injury or poisoning, not the nature of the injury itself. D. To classify adverse effects of drugs. Answer C. To report the cause of injury or poisoning, not the nature of the injury itself. This question assesses your understanding of external cause codes in ICD-10-CM. External cause codes, found in Chapter 20 of ICD-10-CM, V00Y99, are used to describe how an injury or poisoning happened, the intent, accidental, intentional, the place of occurrence, the activity of the patient at the time, and the patient's status. They are supplemental codes and are never reported as the primary diagnosis, which describes the actual injury, e.g., fracture, laceration. These codes provide crucial data for injury research and prevention, giving a more complete picture of the patient's encounter. Question 20. Which entity developed and maintains the current procedural terminology CPT code set? I. World Health Organization, WHO. B. American Medical Association, AMA. C. Centers for Medicare and Medicaid Services, CMS. D. American Hospital Association, AHA. Answer B. American Medical Association, AMA. This question tests your knowledge of the origin and maintenance of the CPT code set, which is a fundamental piece of information for all medical coders. The American Medical Association, AMA, is solely responsible for developing, maintaining, and copyrighting the CPT codes, which are used to report medical, surgical, and diagnostic procedures and services. Understanding the source of the coding guidelines and updates is crucial for staying current and ensuring compliance in your coding practices. The AMA is the definitive authority for CPT codes, so always refer to their official resources. Question 21. What is the primary function of the Global Surgical Package? I. To allow separate billing for all services performed during the postoperative period. B. To bundle all necessary services associated with a surgical procedure into one payment. C. To ensure that only surgeons can bill for surgical procedures. D. To waive all patient co-payments for surgical services. Answer B. To bundle all necessary services associated with a surgical procedure into one payment. This question focuses on the concept of the Global Surgical Package, a crucial aspect of surgical coding and billing. The Global Surgical Package includes all necessary services normally furnished by a surgeon before, during, and after a procedure. This typically covers preoperative visits, the surgical procedure itself, and routine postoperative care for a specific period, e.g., 10 or 90 days, bundling them into a single payment. Understanding the global period prevents unbundling and ensures accurate reimbursement for comprehensive surgical care. Question 22. Which anatomical plane divides the body into anterior, front, and posterior, back portions? I. Transverse plane. B. Sagittal plane. C. Frontal coronal plane. D. Oblique plane. Answer C. Frontal coronal plane. This question tests your foundational knowledge of anatomical planes, which are essential for precisely describing locations in the body. The frontal or coronal plane divides the body into anterior, front, and posterior sections. The sagittal plane divides the body into left and right parts, while the transverse plane divides it into superior, upper, and inferior lower parts. Understanding these planes is critical for correctly interpreting anatomical descriptions in medical documentation and for accurate coding of procedures and diagnoses. Question 23. A patient has a chronic condition documented as controlled hypertension. In ICD-10-CM, how should this condition be coded? I. Coded as essential, primary, hypertension as the documentation supports it. B. It should not be coded since it is controlled. C. Coded as hypertension but add an additional code for controlled status. D. Use AZ code for chronic disease management. Answer I. Coded as essential, primary, hypertension as the documentation supports it. This question addresses a common scenario in ICD's 10 cm coding for chronic conditions. When a chronic condition, such as hypertension, is documented as controlled, it still exists and requires ongoing management, even if the symptoms are well managed. Therefore, it should be coded as the underlying condition, e.g., essential hypertension. There are no specific ICD-10 cm codes to indicate controlled status for most chronic conditions. The condition itself is coded. It's important to remember that controlled does not mean resolved. The patient still has the condition. Question 24. What information is typically found in the CPT index? I. Detailed code descriptions and guidelines. B. Modifiers and their definitions. C. Main terms for procedures, services, and anatomical sites. D. RVUs, relative value units, for each code. Answer C. Main terms for procedures, services, and anatomical sites. This question assesses your understanding of how to use the CPT manual's index. The CPT index, located at the back of the manual, serves as an alphabetical listing of procedures, services, organs, anatomical sites, conditions, eponyms, and synonyms. Its primary purpose is to guide you to the correct code or range of codes based on key terms from the medical documentation. You then navigate to the relevant section in the main body of the CPT manual to find the detailed code description and applicable guidelines. Always start with the index to efficiently locate potential codes, then verify in the main body. Question 25. Which type of insurance plan typically requires a primary care physician, PCP, referral for specialist visits? I. Preferred Provider Organization, PPO. B. Health Maintenance Organization, HMO. C. Indemnity Plan. D. Point of Service, POS, though often has in-network benefits like PPO without referral for some services. Answer B. Health Maintenance Organization, HMO. This question focuses on the characteristics of different health insurance plans, which is crucial for understanding billing and patient access. A health maintenance organization, HMO, typically requires members to choose a primary care physician, PCP, who acts as a gatekeeper and must provide a referral for the patient to see a specialist. This structure aims to manage costs and coordinate care. In contrast, PPO plans usually offer more flexibility without requiring referrals, though out-of-network costs are higher. Understanding these plan types helps coders and billers navigate prior authorization requirements and ensure claims are submitted correctly. Question 26. A physician dictates patient experiencing dyspnea. What does dyspnea mean? I. Difficulty swallowing. B. Painful urination. C. Difficulty breathing. D. Irregular heartbeat. Answer C. Difficulty breathing. This question tests your knowledge of common medical terms related to symptoms. Dyspnea is the medical term for shortness of breath or difficulty breathing. Understanding these fundamental terms is crucial for accurately interpreting physician documentation and selecting the correct ICD-10 cm codes that describe the patient's condition. Breaking down words like bad, painful, difficult, and breathing can help you remember their meanings. Question 27. When coding for a pathology service, what does the term gross examination refer to? I. Microscopic analysis of tissue samples. B. Visual inspection of tissue without a microscope. C. Chemical analysis of body fluids. D. Genetic testing of cells. Answer B. Visual inspection of tissue without a microscope. This question delves into a specific aspect of pathology coding. In pathology, gross examination refers to the macroscopic, unaided visual inspection of a tissue specimen by a pathologist to describe its size, shape, color, and other visible characteristics before any microscopic examination takes place. This initial assessment is a crucial step in preparing the specimen for further analysis and diagnosis. Understanding this distinction helps in selecting the appropriate pathology codes, as services may be separated based on gross and microscopic examination components. Question 28. Which of the following is true regarding rule-out diagnoses in ICD-10-CM for outpatient settings? I. They should always be coded as if the condition exists. B. They should be coded with AZ code for observation. C. They should not be coded. Instead, code the symptoms or signs. D. They should only be coded if documented by two different physicians. Answer C. They should not be coded. Instead, code the symptoms or signs. This question highlights a critical ICD-10-CM guideline difference between inpatient and outpatient coding. In the outpatient setting, rule out, suspected, possible, or probable diagnoses are not coded. Instead, coders should report the signs, symptoms, or abnormal test findings that led the physician to suspect the condition. This guideline prevents coding conditions that have not yet been confirmed, ensuring that outpatient billing reflects only established diagnoses. For inpatient encounters, however, these diagnoses can often be coded. Question 29. A physician performs an excision of a benign lesion from the skin. The CPT code for this procedure includes the local anesthesia and simple closure. What is this concept known as? I. Unbundling. B. Component coding. C. Bundling or surgical package. D. Separate procedure. Answer C. Bundling or surgical package. This question addresses the concept of bundling in CPT, specifically within surgical coding. Many surgical codes, like those for lesion excisions, include associated services such as local anesthesia and simple closure as part of a single surgical package or bundled service. This means these included services are not separately billable. Understanding what is automatically included in a procedure code prevents improper separate billing, known as unbundling, and ensures compliance with payer rules. Always consult CPT guidelines to know what is considered inherent to a procedure. Question 30. Which CPT modifier indicates that a physician performed only the professional component of a radiology service? I. -26. B. TC. C. -59. D. RT. Answer. I. -26. This question tests your understanding of modifiers specific to radiology services. In radiology, services are often split into a technical component, C, and a professional component. Modifier -26 is appended to a radiology code to indicate that the physician is billing only for the professional component, which includes the supervision, interpretation, and written report of the diagnostic procedure. The technical component, C, covers the equipment, supplies, and technical staff. Knowing these modifiers is essential for accurate billing of diagnostic imaging. Question 31. What is the root word in hepatitis, and what does it refer to? I. Itis, referring to inflammation. B. Hepat, referring to the liver. C. Hep, referring to the blood. D. Pat, referring to disease. Answer B. Hepat, referring to the liver. This question directly tests your knowledge of medical terminology, specifically root words. The root word hepat, or hepato- consistently refers to the liver, as seen in terms like hepatitis, inflammation of the liver, or hepatomegaly, enlargement of the liver. Understanding common root words allows you to decipher the meaning of many medical terms, which is a foundational skill for accurately understanding and coding diagnoses. Breaking down words into their core components makes complex medical language much more manageable. Question 32. According to CPT guidelines, a consultation is typically defined by which characteristic? I. A request for opinion or advice from another physician. B. A transfer of care from one physician to another. C. A routine follow-up visit with an established patient. D. A preventive medicine service. Answer I. A request for opinion or advice from another physician. This question focuses on the specific definition of a consultation service in CPT, which has particular documentation and coding requirements. A consultation occurs when a physician requests the opinion or advice of another physician regarding a specific patient's condition, without transferring the primary responsibility for the patient's care. The consulting physician provides a written report of their findings and recommendations to the requesting physician. Understanding this distinction is crucial, as billing for a consultation rather than a referral or transfer of care requires specific elements. Question 33. Which of the following is considered a current best practice for preventing healthcare fraud and abuse? I. Regularly coding services with unlisted procedure codes. B. Performing internal and external coding audits. C. Always coding to the highest possible level of service. D. Avoiding the use of modifiers to simplify billing. Answer B. Performing internal and external coding audits. This question addresses compliance and ethical practices in medical coding. Regularly performing internal and external coding audits is a best practice to ensure accurate coding, identify potential errors, and prevent healthcare fraud and abuse. Audits help to verify that services are documented, coded, and billed correctly, aligning with federal regulations and payer policies. Conversely, coding to the highest level, frequently using unlisted codes without proper documentation, or avoiding necessary modifiers can lead to compliance issues and potential penalties. Question 34. What is the correct definition of a combination code in ICD 10-CM? I. A code that links two or more unrelated diagnoses. B. A single code used to classify two diagnoses, or a diagnosis with an associated secondary process, manifestation, or a diagnosis with an associated complication. C. A code used for a procedure that combines multiple steps. D. A code that includes both an external cause and an injury in one code. Answer B. A single code used to classify two diagnoses, or a diagnosis with an associated secondary process, manifestation, or a diagnosis with an associated complication. This question clarifies the concept of a combination code in ICD-10-CM. A combination code is a single ICD-10-CM code that identifies not just one condition, but also a coexisting condition, a manifestation of a disease, or a related complication. For example, a single code might represent both diabetes and its associated nephropathy. Recognizing combination codes is crucial for efficient and accurate coding, as using them appropriately prevents assigning multiple codes when one comprehensive code exists. Always look for codes that include multiple elements in their description to utilize combination codes effectively. Question 35. When coding for injections, which HCPCS Level 2 code series is commonly used for the administration of the injection itself, separate from the drug? I. J codes. B. G codes. C. A codes. D. 90,000 series CPT codes. Answer B. G codes. This question tests your knowledge of HCPCS Level 2 codes, particularly in the context of injections. While J codes are primarily used for reporting injectable drugs themselves, G codes, specifically G0008, G0009, G0010, are often used by Medicare and some other payers to report the administration of injections. The 90,000 series CPT codes, found in the medicine section, also contain codes for injection administration, but G codes are frequently used for specific payer requirements. Always check payer guidelines, but remember that G codes are often the go-to for injection administration when appropriate.